Hi, everybody. Another amazing week in the pickleball world. We are just a couple of weekends away from our next Major League Pickleball event. Can't wait for San Clemente. This week, so thrilled to have our guest on. We have a fascinating angle, which we have never discussed on here before. He's published more than 300 original research articles. He's world renowned. He's been featured in magazines, appears regularly on Forbes.com, the best at his craft. I'll introduce him in just a moment, but thrilled to have you with us. As always, Mish McMahon, one of the TV broadcast voices of pickleball and Major League Pickleball, joined by one of the founding fathers of pickleball podcasting, an average 4.5 at best,
Uh-huh.
but his pickleball fashion is upwards to the pro levels. He is
I'd
Tyson
say higher,
Apostle.
higher
Higher?
than pro. Yeah,
I'd agree with you. I'll give you
thank
that.
you.
And thrilled to have us joining us this week, Dr. Josh Dines, an orthopedic surgeon who specializes in sports medicine and shoulder surgery. Basically, if you mess up anything in your upper body, you want this guy on your team. For the last 10 years, he's been featured in New York Magazine's Best Doctors. He specializes in surgery for sports-related injuries of athletes at all levels, by the way. He's got a lot of street cred with the professional athletes. I'll get to that in just a moment, but has experience treating professional athletes ranging from the New York Mets, the New York Rangers, shout out hockey. I've been in that world as well. U.S. Davis Cup tennis team, the L.A. Dodgers. He trained under the guy that came up with the Tommy John surgery, if I'm understanding that correctly. And now he was recently named medical director for Major League Pickleball. Dr. Dines, great to have you with us. Before we get started, let's give a quick thanks to our sponsors, starting with Pro XR, the official paddle of MLP, Knockaround, the official sunglass partner of Major League Pickleball, and Aura Organic, the official nutrition partner of MLP.
Thank you, Michelle. I'm pumped. And Michelle, you've had quite the weekend. You're still there, top secret, long after the curtains have closed on the PPA this weekend. You're still there putting in the hours. I saw a headline that it was a very rowdy crowd this weekend in Texas. Is that accurate?
It was the Texans. They were unfazed by what felt like 100-degree temperatures in the heat. There were a
Uh-huh.
couple of amateur players delivered to the hospital, which is not funny. It was hot, and the fans. There were people that drove in from Mississippi. Tyson, 8 hours. Ed and Marcia, happy birthday, Ed. Yeah, it was incredible. The atmosphere was second to none. The play was amazing, and we're going to dive into a lot of this after we chat with our guests here. But yeah, it was unbelievable. Next level environment.
Awesome. Did you let those people that drove 8 hours know about airplanes?
Yes, I did actually.
Okay.
I was like, wait, you drove in to the VIP section and drove, but hey, you know what? Credit to the fans here. And people drove in. There was a party bus. There was a
I saw
college
that.
party bus that came in from the SMU students. Like they're tailgating and coming to pickleball. Like it's on everybody's radar. And it's not just for old people. The college kids are now on board. And this is about to be a trend. I'm calling it now.
Yeah, I mean, we called it years ago since we got involved with the sport. Enough about that. We will get more into Michelle's takes at the PPA, but right now, our guest of the hour, Doctor. I was going to say I combined doctor
Dr.
and your
Wa.
first name, Doctor Wa. That's Doctor Joshua Dines. Josh, how's it going today?
Good. I'm going to use that. Anything to be more efficient. I'm just going to start combining names. So
Yeah,
that's great.
thank you. Yeah, I mean, from time to time, inspiration just hits me, and I don't know from
Guilty check.
where or how, but
Don't
we got
question
to
it.
go with it.
And I feel bad. It was a great introduction. And then as you're saying, don't laugh that people end up in the hospital. I'm cracking up as a doctor. So not great.
Good.
Yeah. We're off to a
Like
great
Michelle
start.
got into, you are in sports medicine and you are a top orthopedic surgeon who specializes in listed as overhand sports, but I know you also work on knees and everything joint related. How did you uh, come into sports medicine?
So, I mean, I love sports. I think it's sort of a couple of sort of roads met where I loved sports growing up, played a lot of baseball, tennis, soccer, golf, hockey, so kind of a variety of sports. I was always a fan of sports. My father was an orthopedic surgeon, so I kind of was exposed to medicine and orthopedic surgery in particular. And he did a lot of sports medicine as well. Has worked with the U.S. tennis tour, like the U.S. Open, and he's the medical director for the ATP tennis tour. So I kind of saw sort of different angles of being involved in sports. I liked medicine, like the ability to help people and make a difference in their life. And I think that when you combine with the love of sports, it was sort of a natural sort of subspecialty. And it's, kind of panned out. It's been great because I still get to play sports, but be around, the highest level of athletes, which is kind of motivating, and both from an athlete perspective and also trying to get them better perspective.
Okay, so what is your sports background then, and when did you make that leap from the athletic side to the medical side?
It was, I guess, pretty easy when, growing up, you always want to be a professional athlete. And
Yeah.
then you realize, kind of college, you realize quickly that and probably even before that, I knew I wasn't going to, play professionally. So I was able to play, JV soccer and play on the golf team at Dartmouth, but that was Northeast golf in the mid '90s. So it wasn't very good. But, it was fun, but I knew that, I wasn't going to have a career in professional sports, but did like medicine and liked that field. So then as you start going down the path of medical school and then residency, you start sort of weeding things out, and sports medicine became something that I loved because you could still be around sports, but really still make a difference in these athletes' careers.
Yeah, it's interesting you say that because I was a collegiate athlete, and very early on I recognized I'm
Yeah,
not winning gold medals here.
right.
I'm not going to be the like I'd love to be, like that's what I daydream about.
Sure.
And I looked seriously at sports medicine because you as an athlete, you are in touch with these people like in the training room and all of that stuff on the university. And so yeah, it's awesome that you made that leap, and you are very, very involved in professional sports across the board on many levels. Can you tell us a little bit about your experiences with all of these professional teams and organizations?
Sure. So, kind of started just after you finish orthopedic residency, and not to get too granular, you pick a subspecialty, which for me was sports medicine, as I mentioned. So I did a fellowship out in Los Angeles at what's called the Curlin Job Clinic, where there are great doctors. Dr. Job, whom Michelle mentioned earlier, did the first Tommy John surgery, which everybody's familiar with now if you're a baseball fan. But that was kind of revolutionary at the time. And then other doctors there, Lou Yoakum, Neil Elatrosh, were great mentors and took care of the professional teams out there. So that furthered my exposure to kind of working with athletes. And I think for some people don't like it, some people do, and for me, it cemented that decision to kind of continue down that path. I had the opportunity to work with the U.S. Davis Cup team, as I mentioned, and there, it was great. Kind of seeing different sports. Tennis is such an individual sport, that you have, it's kind of an interesting relationship with the players. That was at a time when the U.S. Davis Cup team was great. It was, led by Andy Roddick, who's become a good friend and business partner. James Blake, Marty Fish, the Bryan brothers, John Isner, Sam Query, who's obviously a pickleball or now. So it was a great group to be around and, build great relationships. And at the same time, because I spent a lot of time with sort of what you described as overhand athletes, so tennis players, baseball players, swimmers. I worked with the Mets and the Dodgers, and that was fun because I played baseball growing up. But it also was kind of a different sort of approach. Those are team sports. They've got a lot of different infrastructure. They've got a ton of trainers and physical therapists. So it's just kind of fun to see different sports and how you interact differently with different players. Baseball, you have to worry about the disabled list and roster moves, whereas tennis is an individual sport and it's really just that player that you're worried about. So it's been fun, and doing different sports, working with different athletes, I think is provided variety that's exciting.
Yeah, let's what about baseball and like an individual sport like tennis? Like how is your role different there? I know that you're probably working under a specific team on something like baseball or hockey or somewhere like that versus an individual. In tennis, are you working with the leagues and working with multiple tennis players, or are you just like contacted by individuals to be their guy?
Yeah, so it's tennis is it is individual. So you kind of build up a reputation in that sport amongst the players and the agents, and the coaches, and they'll reach out individually. But what's different about tennis versus a baseball, for instance, is baseball, there's a guaranteed salary. They've got a contract for the year. So I think the teams, in a certain sense, can almost be protective of their big investments. So they don't want to rush the players back. They can put them on the 15 or 30-day disabled list and not rush them back, so they can make sure they're completely healed by the time they do return to play. Whereas tennis is tough because if you're not the Nadals and Djokovic's where you've got a ton of points and you're going to automatically qualify, a lot of these players are on the bubble, and if they start missing tennis tournaments, then it gets a lot harder to play next year. So they have different pressures, I think, as an individual sport that are sometimes mitigated in the team sports, and that does factor in to your treatment a little. Obviously you still want to do at the most basic level what's best for the player and their injury and getting them back to as close to normal as possible. But there are other factors that do weigh in on the decision-making process, different from a team sport versus an individual sport.
And how do the players and teams' pressures become your pressures? Like, is there pressure on you then to
I think yes, because they always ask us. They both groups. I think all athletes, and it's not just athletes. It's the routine weekend warrior that I see in the office. Everybody wants you to be able to predict the future and say that you're going to be better in 3 weeks, 2 days, and 7 hours, and you'll be back on the court. So a lot of it is just sort of based on experience, but also kind of reading the room, seeing how fit they are and things like that. But that's really the pressure, is kind of predicting when they're going to be back. And in a team sport where there's roster moves to make, that being off by a few days or a week makes a big difference. And in an individual sport has kind of similar repercussions. So there's pressure, but also, as long as, I think, from a doctor perspective, you're doing the right thing, treating them like you would treat any other patient, not trying to do special stuff, having the same approach does take away some of the pressure, because you can only do what you can do.
Right. Yeah, that does make sense. Let's get into pickleball a little bit then, because you named some organizations, you named a lot of tennis individuals that have been linked and associated to pickleball now. And when was the first time that you got introduced to pickleball, and what were your thoughts?
So it's interesting, and they've come a full 180 degrees, because the first time was probably 6-7 years ago, and I know the game goes back to, I think, the late 60s, if I'm not mistaken, but it's been around for years. I literally first heard about it probably 7 years ago in the office, when there was kind of a rash of 60 and 70-year-olds who winter in Florida coming back to New York with torn rotator cuffs because they were playing, they fell on the pickleball court, and I had no idea what they were talking about. And so I kind of rolled my eyes. I was like, this is a sport for older people, if I could even call it a sport. And fast forward to my office hours last week, when 3 people, like all in their late 20s, early 30s, back to back, came in with pickleball injuries, which I think just speaks to the fact that this is a completely different game now than it was 7 or 8 years ago. And then that was kind of from the medical perspective. From a playing perspective, again, I heard about it, kind of rolled my eyes. I was like, this is just 80-year-olds playing. And then down in Florida, visiting parents, they have a pickleball court, and we were out there. I was like, oh, we'll give it a try. Everybody's talking about it, and it was addictive. It was so fun, and a game that I could play with my 9-year-old daughter and my father, who's 70, and everybody could play because everybody's like decent, and it becomes a very democratic game, I think. So that made it a lot of fun, and made me a fan as a player and a participant.
Michelle, have you experienced any pickleball injuries?
I have not, but I'd be curious to know which injuries are the most common in your experience, because I could see it happening if I played more regularly, especially with the rotator cuff labrum area. But
Yeah.
Tell us, Doc.
No, I mean, you hit the nail on the head. I mean, I think that's some of it. And what's interesting is, obviously, you're not serving overhand, so a little different than throwing a baseball or serving in tennis. But what I
You
found
haven't seen
interesting
me
is,
hit overhead, have you?
not yet.
Full
No.
throttle, but it
Nice.
doesn't go
Good. Not all
anywhere.
that.
Anyways,
That's right,
it doesn't work. It's not effective, but keep going.
Well, as long as you keep doing it, getting injured, I can fix it at some point.
Okay, good. Glad we're talking.
But I was going to say, realistically, I think it's kind of sort of two sort of different injury distributions. One is, again, not to pick on the older people, but like, because it is such a, sort of an accessible game, they're out there, they haven't played sports for a while, but they see this as sort of an easy thing to do. Their friends are doing it. They're out there, and they may not have sort of the balance, or that, the low, and, I see some sort of acute injuries where they fall, tear their Achilles, kind of more traumatic type injuries as such. Then the other end of the spectrum are kind of the overuse injuries, where, both young and old, again, it is so fun. Tennis, you go out there for 45 minutes, you hit the balls, you're done. This, people are out there, they're playing 3-4 hours. It's so social that I think, it's easy to kind of get sucked in, and next thing you know, you've been doing it all morning, and it just becomes an overuse type thing. So rotator cuff tendonitis, things like that, you would typically see in tennis because you're playing at a much higher intensity. Here, people almost get suckered into thinking it's sort of easy, and then they've been out there for a long time and playing a lot and playing every day, and you see the overuse injuries.
So you talked about that, like people coming in, older people coming in after falling down on the court. Was that how common
That's
is
one
that?
of them, and I think that's where it started.
Okay.
Where they'd land on their arm and tear their rotator cuff or tear their Achilles. But I think as people have gotten sort of almost approached this more as a sport,
Hmm.
now we're seeing these kind of overuse type injuries that we'd almost see more like in tennis.
Right. And, for some of our older, more mature listeners out
Yeah,
there, I've also fallen on the pickleball court
absolutely right.
multiple
I'm not above
times.
that.
Like,
Yeah, don't
I'm,
misinterpret where I'm coming from. Absolutely. Yeah, I just haven't
but
gotten into doing it yet, but it's just a matter of time.
that's what I'm saying too. Like right now, I still know how to fall, but there's going
Right.
to come a time where
Yes.
I land wrong.
I'll
And
give both of my cards. Exactly.
yes, give
I
everyone
think
your card.
I think people need to start studying film of Elise Jones and her volleyball rolls on the court. Stop, drop,
Yeah.
and roll. I'm just
Yes.
saying.
Yeah.
She's the only graceful follower I've seen in the pickleball world.
I mean, honestly, it makes a
Not
difference.
Jill
Yeah.
Braverman
Falling is an
and the bubble
art.
girl.
It is,
Yeah.
Yeah,
yes.
It is an
yeah.
art for sure. So what can you do because I'm playing with a lot of guys. I've had one of the guys I play with has had elbow surgery. Another guy's been like, trying to nurse his elbow. Another guy's got a shoulder thing. When those injuries first start showing, what are actions we can take, or is there preventative stuff we can do before any of that even happens?
Well, I think, both. I mean, so I think, look, it is a sport. So I think preventive, you don't want to go from just being sedentary, just watching Netflix, to saying, oh, all my friends are playing pickleball. I'm going to get out there for a few hours. So I think
Oh, that's what I did. And I
that's the
hurt
problem.
so bad
Yep.
for months. My
That's the
lower
problem.
back, my
Yeah.
shoulder. And I'd still just go out and play and be like, I'll play through this because that's like
Right.
old 80s, 90s mentality. Like, let's play through this
Exactly.
pain and become stronger for it.
Yeah.
I'm fine now and everything is adjusted, but like, yeah,
No,
okay.
I think that's one of the issues. So I think just like any sport, you have to kind of build up. So, just doing kind of core stuff will always help, lower extremity stuff, strengthening, getting in better cardiovascular shape, all these things that sound cliche, but, just don't go out there and show up at the court and play for kind of a 2 hour round robin if you haven't done it. So I think that is the kind of the preventative, just the stronger your core is, the stronger your quads and hamstrings, shoulder muscles, like your rotator cuff muscles, especially, for kind of the more mature patients, just doing like the band work, things that are kind of annoying, but you
Mhm.
can do them in, sort of 10 or 15 minutes, like people get ready for ski season, it should be the same approach.
Hmm.
I think at the back end, what you were alluding to, you've got to listen to your body because I think that the trap here is it is so fun and, you don't think you're doing too much. And now you've played for hours and you get these overuse things you mentioned, kind of elbow, like tennis elbow type things and rotator cuff tendonitis. I think the real key with this or any sport is listening to your body because you don't want to try to push through and then you make something that would have gotten better with a little rest, and maybe some anti-inflammatory medication or ice or some physical therapy. Now you've made it into a much more serious injury where you're going to miss a lot more time. So while at the time, I had the same mindset as you, which just push through, it'll be fine. I think, discretion being the better part of valor, listen to your body. If you need to take a few days off or even a couple of weeks off, that's fine because this is a sport also that you can kind of play year round, which is great. So if you miss a couple of weeks, it's better than missing a few months because you've tried to push through it and now you've made it a real injury.
So let's throw a hypothetical at you. And I think it's just a common one is I'm playing pickleball. I'm taking overhead swings, smashes, and my shoulder just starts to ache. Like, am I then going home, icing it, taking some days off, waiting until I don't feel it at all? What is the play there?
Yeah, the first thing I think, like, distinguishing, sort of pain is if something hurts while you're doing it. Like if you're out there and every overhead is hurting, you got to shut it down because then you're, making it worse. If it's
Okay.
a little sore afterwards, that's when I think, as you said, the ice, anti-inflammatories, and and you're probably going to be better in a couple days, or even the next day. Really just listening to your body. But the hurting while it's happening for me is a problem, and that's when you should shut down. Or if it lingers afterwards, like if it hurts playing, but then just waking up from sleep at night, putting on a sweater or a jacket, reaching for a seatbelt, when those things start to hurt, the everyday activities, I think that's when you really have to start listening to your body also, and kind of taking it a little bit more seriously in terms of at least trying to get this better as opposed to pushing through.
Okay. And you are
I'm sorry to
the
interrupt. I was just going to say,
oh, go
like
ahead.
especially when people are starting, they always asking them like shouldn't hurt while you're doing it. Sore afterwards, almost like it was a good workout because you haven't done anything. I think it's okay, as long as you don't rush back. But pain during is bad.
Okay.
Mm.
Got that, Michelle?
Yep, I got that. But what advice? I'm a power thrower as well. What advice would you give to some of these pros who are obviously in good condition?
Yes.
They play often, they play a lot, but they are obviously exposed to more wear and tear. So, like, if you take somebody that would be more, I don't know if they would be more or less predisposed to injury over time, but what would your technique be for the pros out there that are doing this religiously and trying to avoid injury while also trying to maintain their pro career?
Yeah, no, that's a great question. I think that gets what we were talking about before. We're like, you have to assume they're coming in sort of being in shape. So they've done, they've done the work to kind of get to that level. And that look, it's a profession for them.
Most of them have.
Theoretically, yes. Um, so for them, it's a profession, and that's what we were kind of Tyson asked about earlier, where they've got to get out there and play. So it's a balancing act. If they can play through it, and they're still playing at their normal level, then it's probably okay. And really focusing on the kind of the rehab afterwards. Really, it's probably easy to skip your band work or icing afterwards or the anti-inflammatories. But I think being diligent with that on the back end is important. But if it's sort of compromising their ability to play at the level they're used to playing at, then that's a different story. That's where they've got to, shut it down. And, even if it's frustrating because you're missing a tournament per se, it gives you the chance to get back and play the rest of them as opposed to sort of being half as good for the rest of the tournaments.
What's the balance there for these pros? Because every time they're not playing, they're potentially losing money.
No, that's why it makes it tough. I think it's harder for the individual athletes vis-a-vis the pickleballers, the tennis players, because if you're on a baseball team, it's a guaranteed salary and you're fine and, take your time to get better. With them, it's really, and this is where I talked about earlier, it's about kind of, they want the prediction as to when will I be better, and I think setting reasonable expectations is key because look, they're athletes, they get it. They know injuries are almost part of the game. It kind of happens to everybody. And if they can kind of be smart about it and say, look, it's going to be 3 weeks, you're better off telling them it's going to be 3 and they're back in 2, as opposed to saying it's going to be a week and then every week they're starting to push it and they don't get better. Now it's been 6 weeks. So I think if you can kind of set reasonable expectations, allow them to plan their schedule accordingly, and give them something to work towards, that really helps, as opposed to setting unrealistic expectations. But that's the tough part about an individual sport, whether it's tennis or golf or pickleball. If they're not playing, they're not making money. So it's, but it's that double-edged sword. If they rush back, they're never going to be 100%. So.
Right. Or risk further injury.
Yeah. And I think that's where it's key to have a good relationship with the players or the athletes where they trust your opinion, they, and that's where, the individual sport's a little different. You really have to build a relationship with the players, their agents, their team, so that you can come up with a good plan and they trust you, because if they don't, then they're not going to get better, or it's not, it's going to take more time than it should.
Can you speak real quick on what are the top injuries you're seeing from casual pickleball players and pro players?
So casual is easier because, again, I think a lot of that is just doing it because it's so fun and they're just not ready for it. So it's those, again, that the group of the younger people playing for hours where the tennis elbow and the rotator cuff tendonitis, which the good news is that often gets better conservatively, whether it's physical therapy, anti-inflammatories, things of that nature. The older patients, more mature, to use your term, who just haven't done anything for years, and this is going to be their gateway back into sports. It's a lot more of these sort of just falls, and not to, to oversimplify, but like just they don't move as well around the court, but you're kind of lunging for stuff. It's not an easy sport from that perspective. And then we see a lot more sort of acute rotator cuff tears where they land on an outstretched arm, tear their Achilles, things like that, which unfortunately tend to be more surgical fixes as opposed to the conservative treatment. At the professional level, for better or for worse, look, it's relatively new. So we don't have the same track record of data that we have for like the ATP tour, but we are seeing, I think it's a lot of lunging. It's a lot, almost like sore back injury. It's not anything terrible per se, but back injuries, and that to Michelle's point, a lot of just repetitive overheads, things of that nature, where it's a rotator cuff tendonitis, labral tears, because a lot of these people grew up playing tennis and overhead sports, so they probably have some underlying stuff to begin with, and then it just gets exacerbated by playing at a professional level.
Okay. Yeah, that's interesting. It's I mean, I can totally see that, because these pros, they are all fit and ready to go,
Yeah.
but when they are doing so much every day on the court,
Right.
that and you together with Hospital for Special Surgery is the official hospital partner of Major League Pickleball, and
Yes.
you're the medical director for MLP. These players now are able to talk to someone from your staff and from your team at each event they go to if they have any issues.
No, it's great because they've given us the opportunity to kind of have myself or another sort of musculoskeletal or sports medicine doctor on site, the physical therapist from HSS. So we're biased, but it's always, sort of ranked the #1 orthopedic hospital in the world. So I think the players benefit from that care, and at least, especially in the absence of a team, even though these are team sports,
Mhm.
it's not the Mets or the Dodgers where you have a full staff of, medical doctors. This at least gives them a home base, I think, that they can go to and trust the opinion and start to build a relationship.
Yeah, that's fantastic.
Yeah,
Also,
I love
do you
that.
guys cover any like over commentating injuries or anything like that? Because I know
Yeah,
Michelle's been out there
you're
for
already
like
struggling with your words. Yeah, we're gonna.
60
Yeah,
hours a week.
yeah,
And my vocal
it's
cords could
yes,
use some work. Yeah.
nice. Different
No,
hospital,
I
but
think
yeah,
I'm gonna find my way to one of these HSS facilities here
yeah,
soon.
definitely. Yeah.
Oh, so good. What brought you to pickleball in the business sense? Like, why was this an appealing business
Honestly, I
move
just,
for you?
I think, it just had the popularity, the amount of people I was seeing with these injuries, combined with sort of my history kind of taking care of overhand athletes and HSS's affiliation with a lot of tennis events became sort of a natural, kind of gravitation. And then friends of mine are team owners and have helped kind of found the league. So that kind of introduced me. So I think from multiple levels, it was just kind of fun to be involved with. And I mean, it's unbelievable how popular it is. So I think I'm excited to be sort of in on the ground level and see how it grows.
Do you have
Yeah.
a favorite player?
Ooh.
No, I can, yeah,
It's
Yeah.
okay.
Top
Throwing you right
player
on the
by
spot.
personality and
yeah,
top player by skill.
yeah. Sam Query is just an old friend for years. So I always root
Okay.
for him.
Perfect.
Yeah.
That's a
Yes.
safe choice.
Yes.
Everyone's favorite.
No, then I get no originality points.
No, you
Yeah.
still do. He's polarizing in the pickleball
Yeah.
world.
Yes, I follow him on Instagram. Yes, but yeah, no, and
He's
it's
fun.
funny because of his personality there. But I loved, Sam was kind of a practice partner in the Davis Cup team 20 years ago. So I've known him, since he was kind of in high school. So it's fun to see his whole career progression.
So enough of the injuries, because I'm getting very sad just envisioning myself falling one day and having to call you and be like, listen, don't tell anybody I fell.
Yeah.
What are the benefits for these people, especially like you're saying, the guys that are coming off the couch, discovering pickleball? What are you noticing in those people?
Well, I think it's great because, obviously we talked about kind of the negatives, the falling,
Yeah.
not being ready. But the flip side of that is these are people now who weren't being very active. I mean, now, just getting out there playing sports, there's just a ton of benefits from that perspective. Just being athletic and, doing more. But I think you factor in the social aspect and it's great. I mean, especially just it's different than going hitting, two people hitting tennis balls, for an hour on a court and you walk off. Like every pickleball place that I've been to, it's, multiple courts, people are socializing. I think they've built sort of a whole social, sort of calendar around it as well. So you get the sort of athletic benefits, but also the social benefits, which everybody, I think benefits from. But especially, that older group, that becomes a huge, win.
Yeah. I
So I don't want to scare people off. I mean, injuries are going to happen doing anything, but
yeah.
I think the benefits far outweigh the risks.
Yeah.
Yeah, I agree. I also I followed this doctor on Instagram who was talking about paddle sports and said that like there's even a mental
I
aspect.
saw that. Yeah.
What do you think about that? So basically,
It
I'll
was like, I think
summarize
they
it
were
for
talking
our
about ping
listeners.
pong or something. Oh, I
Yeah,
saw that, but you're right. I'm like, oh, look, anything hand-eye coordination, all these things. There's, I'm sure there's some study to say that there's a benefit to everything we're talking about, which is great.
I
yeah,
thought it said it extended your life for like a couple of years or something,
yeah.
right? Like, or
Because
kept you sharper because your brain, because
Yep.
it uses both sides of it or whatever.
Yeah.
yeah, it
That's
uses
cool.
the
So I'm
strategic
sure it's
element
applicable
plus the
to paddle
quickness.
and yeah, to your point, any kind of paddle sport, racket sport is going to benefit from that.
Yeah, that's
That's cool.
very good news for us
Yeah.
who play pickleball. Um, what is the difference between like the tennis side and the pickleball side? Is there a difference? And if so, what are those?
Um, I mean, I think tennis. So if you're like, we got with the French Open going on, realistically, I mean, that still becomes a more sort of grueling sport. You're playing for 4 hours on red clay.
Yeah,
It's different. You're hitting, as we talked about before, like just a lot more serves over it. So I think, it's definitely more difficult, which is why we don't see again these 70 or 80-year-olds just picking it up for the first time. But I think at the professional level, some of these points are back and forth. It's quick reflexes. It's like doubles tennis more than singles in the sense that it's just a lot of fast, rapid points back and forth. So I think great agility. really need hand-eye coordination at the net. So, and I think as people play more, we will see a lot of these overuse injuries, similarly that we do see in tennis.
Yeah.
Probably less, but and I was gonna say even less sort of back injuries because you're not serving, but it's a ton of overheads. So there's probably, as people play more, it'll probably be a very similar injury profile.
Yeah. Yeah. That's interesting. So, you're the expert for sure.
Yeah,
And
I don't know about that,
no, it's incredible. I love that the MLP athletes are being taken care of at the events. I'm assuming that if they have issues at the events or something, they can get on the phone with you in between events and figure stuff out and get some advice and some medical treatment as well.
No, exactly. Yeah. I mean, we're kind of boots on the ground. We're at the events, and then, everybody's always kind of one phone call away if we need other specialists, which is good.
Yeah, that's amazing. And just, I mean, one of the ways that Major League Pickleball is taking care of their family. And
Yep.
we're happy to have you, Dr. Josh.
No, it's great to be
Exciting
on.
times here for pickleball.
Yes. Welcome.
Thank you so much. Really appreciate being on. You guys are great.
Yeah. Yeah, thank you so much. And we will
Hopefully meet in person.
definitely. Are we going to play some pickleball?
Yes. Well, I got to practice up first, but yes.
Are you coming to San Clemente?
I'm not going to be in San Clemente. Definitely Atlanta, and I'm going to try to
Okay.
get some others. So.
Okay,
Okay.
well,
Like,
hopefully we
not-
meet on terms of playing pickleball and not because we're injured.
Yeah, exactly right.
Or, I mean, worst case scenario, both. Like,
Right, yeah.
after I play, I'll be like, Josh, my back
At
is
least
sore.
you got hurt while playing with me, which
Yes,
is good. That's
correct.
better. Yeah, I got to drum up some business.
Okay. I want to thank you so much for your time, Dr. Josh, and everything you're doing for these pickleball athletes. And is there any place online that we can follow you or see any recommendations or anything like that? Are you on Instagram?
I'm on
anything like
Instagram. I
that?
think I'm not like great. Yeah, it's not going
Not
to make me much
yet.
better. Yes, right. I'll be better. But like, you'll see pictures of my kids on their birthday. But
It's not going to
yeah.
make you much better at anything, but you can follow me.
Literally not better
It's a
at
feel
anything.
good.
Yeah, but now you'll motivate me to do more. So J Dines MD.
Perfect.
And then at HSS, if you ever need to find me, you can email me anytime.
Excellent. Thanks again for your time.
No, thank you guys. I really appreciate it.
Yeah,
Yeah.
thank you so much. Hope to see
And-
you soon.
Big shout out to Hospital for Special Surgery being the partner of MLP. Take care, everyone. Bye. Michelle, I learned a lot. Did you?
Don't fall.
Do not fall.
That's what I learned.
Or fall correctly.
And stop hitting your overhead so hard. You big dum-dum. It's not going anywhere.
Oh my gosh. Yeah, I used to
Find
swing.
your angles. That's what I
used to
said
swing
to
so
myself.
hard at overheads,
I
and I
still
would
do. I
feel
can't
my
help it.
shoulder. Do you feel your shoulder every time you swing
Yes.
that?
Yes.
But adding weight to your paddle helps. Like that's something
Yeah.
I've done. And also having that little like wrist fling that a lot of the pros have that have mastered, where you can somehow get like so much more power and speed on the ball.
Apparently, you just have to get a new paddle and you can turn into a different player. Allegedly.
Ooh.
Those are the rumors from the weekend.
Okay, well, I
Hot
got some new.
rumors
Got
that are
some new-
causing some disturbances across the PPA tour, but
Really?
that's nor here nor there. Yeah.
Well, you were at the PPA tour all weekend. You're still there, top secret, doing top secret stuff.
Top secret.
And let's hear about your weekend, because you are
Yeah.
the voice of professional pickleball across multiple platforms. You probably watch more pickleball than anybody except for maybe the people sitting in the booth next to you. Like, I can't imagine. The streams are like 13 hours long.
I know. I
Who's
always
watching all
wonder.
of that?
I'm like, there's no way somebody's actually tuning in for a full
Yeah.
12-hour day. But if you are, thank you. We love you. Yeah, that's why I always reintroduce ourselves. I'm like, Michelle McMahon here, in case you're just joining us, and Dave
Yeah.
Fleming. But yeah, no, it's like it's been so like the level's getting so much better, Tyson, and it's like the top tier is still the top tier, but you can
Yeah.
feel the next wave starting to creep in. Like, I don't think there's anyone that can dethrone Ben Johns and Annalee Waters at this point, but you see a lot of promise, and that's, I think, the biggest takeaway for me this weekend after
noticed that
watching many,
too.
many hours. Yeah.
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 I noticed that too. I kept up. I'm on vacation. I still was watching, streaming some, not all 13 hours.
Mhm.
And I also thought, like, the top is still the top. Like, we see
Top's
them
still the
get
top.
beat from time to time, but they were very dominant. They had some moments, but they were never in like real peril.
Except Annalee Waters in singles.
Yeah.
Almost Poor Leia Jansen's getting hit by the memes of pickleball this weekend.
I
This
saw that.
weekend, I felt she had it. I was like, this is amazing. She's jumping in the booth with us next weekend. So I was like, wow, it's going to be like on the heels of a gold medal upset over Annalee Waters, her first one of the year. And then, but then to your point, it's like, that's why the top is the top. But there are a couple other players I want to mention on the weekend.
Yeah. Let's hear some of your takes.
Yeah, a big take. I think the biggest headline for me this weekend would be Jaume Martinez Vic. And although he did not beat Ben Johns in the men's singles gold final, he put on a show and he pushed Ben Johns to 3 games. And some of the plays that he came up with, you have to go back. I can't remember if it was game 1 or game 3. It was one of those two. He was dropping back on his back foot and hit a rolling passing shot past Ben Johns from the middle of the court, which does not happen. This guy, he was a hitting partner with Rafa Nadal. So he's got a cool story back, a cool little background. He's from Spain. He's electric. He kind of resembles like Carlos Alcaraz on the court. Dave Fleming has been saying all weekend, but just a fun player to watch. So that's one storyline for me. We had a couple of MLP duos too. Sorry, go ahead.
Let's talk about Vic for a second here. He beat a ton of superstars on his way to the finals.
Yes. Valid point.
So he was
top 10.
Incredible. Do we see him play doubles anywhere? What are his chances of being in MLP here, getting drafted at some point?
Oh, well, I mean, I think after this weekend, his stock absolutely rose. I don't know if he's premier level yet. I think he would at least get a shot at challenger. I would imagine he would definitely get a shot at challenger, and work his way up from there. But if I'm a GM drafting in terms of the Dream Breaker, I've got my eyes on him. I think he's got to establish himself more in the doubles game. Obviously, now with that performance, you have more men players at the top that are like, who's this guy? I kind of want to partner with. Okay, like if he can develop that side of his game too, as well as the mix with some predominant players, you have to start partnering up with people that can beat the top, I think, or develop that partnership if you can find it. But I can't see why not. I think for sure challenger level. I would be surprised if he didn't crack into the challenger level with how he's been performing lately, because he has tools. We've seen people make their runs, right? Every weekend we see a new, Connor Garnett pops in Atlanta. Schick had his moment, a couple of weekends ago. This guy seems to have more tools in his toolkit, and I see, and Dave sees it too, the upside in his game, and just a different ability. Like some of his passing shots were ridiculous. They were so good. And he was one of the few players I've seen that can mobilize with the cat and mouse game of Ben Johns. Now, granted, Ben Johns still came away with the win, but I haven't seen Ben Johns as tested in singles as much as, well, of course, Federico Stassi probably has something to say about that. But I like this guy. I like where he's headed.
Okay, we're going to see him perform again this next weekend.
Yep,
Okay.
I believe so. I believe he's in the field heading to San Clemente, as are we for the MLP. Yay.
Yeah. Okay.
Woohoo.
Who else we got? What else you watching?
I had a couple of partnerships I wanted to mention. Lindsay Newman coming back into the field. We haven't seen her since Austin, and credit to her. It's not easy to just jump back in at that level and just play lights out. Made it to the championship round, forced 3 games against AL and Ben Johns. And they didn't win, but it was kind of funny. If you missed the broadcast, go back and watch it. There was like the first 4 points or something. She was screaming at Riley for taking a couple of out balls. She was like, out! And then he hit him, and then he let one go that was actually in. She was like, that's the one you don't hit. Anyways, it was pretty funny. But they're just a fun duo to watch. And now that Riley's a hometown guy. And then we had some MLP partnerships, Tyson. We had Anna Bright, Lacey Schneeman.
Aren't Riley and Lindsay a MLP duo?
Yes, you're right.
Yeah. The Hard Eights have to be happy.
For one of our favorite squads. Yeah, the Hard Eights.
Yeah, the Hard Eights. One of our favorites. They're all our favorites.
They're all our favorites.
But so you have to be happy if you're a Hard Eights, if you're on the Hard Eights team in any capacity or a Hard Eights fan, you have to be excited about this performance. And Lindsay's probably gearing up for MLP by coming out and doing some of these tournaments.
I'm still surprised they haven't had the level of success as you would expect with those two players on it. But hey, I think San Clemente will be a perfect opportunity for them.
Yeah.
And then Anna Bright, Lacey Schneeman from the New York Hustlers were reunited, looking pretty good. I think Lacey was tested towards the end of that match, and Megan Dazan and Etta Wright were the team that took them down, the 7 seed. So that was a on paper upset. I really like Etta Wright and Megan Dazan and the way they played together from the Seattle Pioneers. Obviously, Megan, we've had
Yeah.
her on, one of the MVPs from whatever season we're in here. Sorry, my brain is a little fried here at the office.
From
But yeah,
event number 2.
from
Yeah.
event number 2. Yes, thank you. And yeah, they look good. Top form. Seattle Pioneers, I don't know if I see them getting beat in San Clemente.
Yeah,
or
it's
ever.
hard. And these guys, like you said, Dizon and Wright, they won a gold not too long ago as a duo, and now they're here again in the finals.
Yes, they
and
did.
I mean, that's got to be good news for those teams. Bad news if you're not on their team.
Yep. And then my last little takeaway was Annalee Waters. This girl played 4 matches on Sunday. She started with a semi. We got rained out on
Yeah.
Saturday night. So she started Sunday morning on a semi, finished that. Then she moved on to doubles after that.
Yep.
Like she had a little bit of a break. Won the doubles gold. Then moves on to singles and goes to a three-game thriller against Leah Jansen. Like barely hangs on. She's like chugging a Coke on the sideline because she's exhausted.
Man.
The heat. And by the way, it felt like I was standing outside and just like sweating. It's so hot. And then comes in for the mixed doubles. And granted, we switched to 2 out of 3 because it was a national broadcast. So comes in to win and takes it. It's just unbelievable. I know she's 16 and you're a lot more resilient at that age than you are when you're our age. But I still think she played a full weekend. I mean, she's playing every day, Thursday, Friday, Saturday, and Sunday, all day, like in intense matchups. So, I mean, granted, it's nice when you have a partner as Ben Johns, but AL's my kudos of the week, and we had her on last week. It was a great episode. If you missed it, go watch it. It's one of our top hitters, and that's what I got for you, Tyson. I can't wait for MLP San Clemente. It's so close.
I can't either.
We're going PPA San Clemente and then MLP San Clemente. So I will be in California for 2 weeks. Can't wait.
Ooh, yeah. You could be in California. A little respite from the humidity, probably.
Yes.
In Texas,
Apparently it's
I
gonna be
did
cold.
see. Ooh, that's nice. Yeah, get that
Like
coastal
67
wind.
degrees.
Oh,
Yeah.
that's going to be amazing.
I know.
I did see McGuffin's post about the heat there. He went through like over 20 shirts, but I mean,
Yes.
McGuffin is a world-class sweater. Like, I don't know
He
too many
really
people who
is.
sweat more than McGuffin. I have I have some friends that do, but they're not like famous for it.
He really did. Like he would change into a new one, and you'd think he was like that was the one that
Just
he was
putting
supposed
on
to
wet
change out of.
shirts.
He really
Yeah,
would.
just
I'm like,
wet
I don't know if
shirt
that's
after wet
effective.
shirt.
I think you should just go full skins.
You think? Yeah.
Yeah.
There's no
I
dress
mean, he's
code
tatted
there.
up on the center or the front of his body, anyways. It's basically
Yeah.
a t-shirt.
Yeah.
Why not?
That'd probably
I
get
don't
real
know.
slippery though.
Gotta keep it PG. Yeah, that's funny. There was a moment in the singles match, I think it was with Ben Johns, where he threw the ball back, or was it Ben Johns? Somebody. And there was like a flick of sweat on it. And he was like, he like
Ew.
bounced it off. Ew. Yeah.
I've had that before. I've had people throw me a sweaty ball, and I'm like, yeah, what do I do with this? And then I like run home and wash my hands immediately after playing pickle. And then I'm like,
Oh
don't
my
touch my
gosh.
face. Don't touch anything.
Don't touch it.
So
I know.
yeah,
Disgusting.
just-
But hey.
but it's a beautiful natural thing, sweating. It detoxifies the body. Sounds like you have your hands full, and you right now are
I do.
still top secret working at the PPA right now
Top
for
secret.
some unannounced news that's going
A
to be
very fun
pretty
project
cool.
that
Very
puts
cool.
me in this dark closet studio is all I
Yeah.
will say.
I like it. And then you're going to be at San Clemente PPA and then MLP PPA. Also, along those lines, you can
Yes.
buy your tickets for
Yes.
MLP San Clemente on MajorLeaguePickleball.net. You can also watch past broadcasts. And if you are an aspiring Major League Pickleball professional, you can now put in your applications
Woohoo.
for next season. And very, very exciting stuff. So
Yay.
to all the pros out there who missed it last time or who have had killer weekends, we hope to see you apply. And yeah, anything else before we take off, Michelle?
No, that's it. Can't wait to see everybody out at MLP. I expect it to be the best yet because every event just up levels the next. Saw the commish Brooks Wiley out playing in the PPA event this weekend. I wished him well, and I haven't gotten his results yet. We'll have to circle back on that for next
Okay.
week's edition of the pod. But yeah, no, that's it. Can't wait to see everybody. Hope you've been enjoying the pickleball coverage. I have been. So, and it's keeping me very, very busy living out of my suitcase the next 4 weeks.
Good to hear.
So-
One of the foremost pickleball experts. I mean, they say 10,000 hours, and then you're an expert, and you've done that in like 2 weeks. So every
don't
2
know.
weeks, Michelle puts in about 10,000 hours of pickleball. All right.
Thank you.
That does it here for Inside Major League Pickleball. Thank you all for listening. Until next week, paddle taps, Michelle.
Paddle taps, Tyson. Don't
That's
fall.
what we do here. We do
Don't
paddle
fall.
taps.
Riley Newman doesn't, but we do.
We do. We're paddle tappers. Okay, take care, everyone. See ya.
Bye.